I agree.
All right, well, we'll go ahead and get started. Thank you guys so much for registering to attend the 2024 NOFO Day of Learning. This is part 1, so from 10 to 12, and we're going to talk about the 2023 NOFO scoring debrief. We have 2 more sessions this afternoon. From 1 to 2:30, we're going to hold a new applicant training. And then from 3 to 4, we're going to do a expansion Q&A for all of our existing grantees that are interested in an expansion grant. We're going to be in the same room here at United Housing Connections all day. And just a reminder that we're going to use the same Zoom link for all of the sessions as well. I'd like to do some really quick introductions, just to help, create a nice, comfortable environment where we all know each other. So if you don't mind, if you'll tell me your name and your organization. And then on a scale of 1 to 10, how involved do you feel in the Upstate continuum of care? I understand that that's a subjective, kind of open-ended question. So really it's just your perspective, how you feel, and that's what I'd like to hear about. And then if you can think of one sentence on how UHC and our executive committee can help create an environment where everyone feels informed and involved in the CoC. So we'll start here in person and then I'll roll through Zoom. My name is Natalie Rivera with United Housing Connections. I am a 10 out of 10 and involved in the CoC.
I hope you're. Did you want to have a sentence? Or
yeah, my sentence can be, really just continuing to hold frequent and participation-based trainings in different places in our CoC. So we're holding one here in Greenville. We have loads of other things that we could be talking about, and we need to start venturing out into our other chapters and everything too.
hello, everybody. My name's Bruce Forbes with Share, and I believe I'm at a 10 as well in terms of how involved I am with the Upstate CoC for many, many, many years. In terms of the sentence, I think having these types of meetings is really, really helpful, and really want to make sure that our CoC is constantly inviting others to participate. Even if you're not a direct home or housing provider, you're still part of the continuum of care, and many, many hands make light work.
And I'm Stephanie Cole, and I'm the Chief Programs Officer here at United Housing Connections. I would say I'm a 8, 9, 8. I am involved with some of the committees, and I attend the CoC meetings. One sentence, I would say, being new to this field, just the CoC's willingness to answer questions and be patient with those of us who are learning is where you would feel welcomed. That's good.
Mm-hmm. My name is Anna Johnson. I think I've talked to all of you a lot. I am our HMIS system administrator. I would also say I'm probably a 9 to 10 up there. I feel very involved on a lot of different levels. And I guess just to echo some of the statements that have already been said, I think frequency and accessibility of trainings, making sure resources or pathways to that are really easy, and just continuing this conversation. I think this is a great start for us, and just to continue on the path.
I'm Mark Derwin. I'm with Meg's House in Greenwood. I would say my scale would probably be a 9.5. Again, yeah, I just think the continued collaboration among, our different agencies has definitely, been a good thing. We at Meg's House have tried to kind of open some of those lines of communication with particularly some of our other DV agencies in our CoC. So I think just kind of reaching out and doing that type of collaboration helps as well.
Thank you. I'm Candace Timmerman with United Housing Connections, and I would say that I'm a 10. I've been doing continuum of care work for a long time. I think that what we can do to help create an environment where everybody feels informed and involved is to invite people to serve on committees. I feel like when you serve on committees, that gets deeper down in the weeds of things and helps you kind of have a more collateral understanding. So I do think that is important.
I'm Nona Henderson. I'm the Coordinated Entry Systems Manager. I also feel like I'm a 10, involved with the CoC. I think something that we can continue to do is, again, echo on a lot of you, continue to have these trainings, to open up room for dialogue, and to extend and stretch out the reach of the CoC. I really liked your point with many hands. I would like to see more of that.
Thomas?
And I'm Thomas Wood with United Housing Connections. I'm the lead outreach specialist. Also, I work with Nona on the Veterans Master List. I feel that on a scale of 1 to 10, I'm probably I don't know, 8 maybe, because I spend a lot of my time doing outreach, so that keeps me, but the point is lead outreach and so forth. Outreach is more than just reaching out to our homeless individuals that are on the street. It's going out and meeting with new partners and new individuals that are new partnerships that could be formed with other organizations that are in the community, and helping build those bridges to bringing them into the CoC and building that village that's going to help all the individuals that we deal with on a day-to-day basis. So if I could say in one sentence how UHC committee can help create an environment where everyone feels informed, it's that we utilize our strengths to build on those bridges that we've already built, repair some of the bridges that may be crumbling, and build new bridges with new partnerships, and explain to them why it's so important that we have this collaboration.
Thank you. All right, we'll go to Zoom. I'm just gonna go down the participant list in alphabetical order. Angela Gaines.
Good morning, everyone. I'm Angela Gaines, and I'm with First Impressions of South Carolina. I am the community outreach case manager for First Impressions. We do case management and everything here. Of course, you guys know that we are advocacy and we help advocate for families, and it's kind of like a referral portal for them. And we have our food pantry and everything here. So I'm just been here about 3 months now. So I'm just kind of learning everything. I love the CoC because it gives you a chance to get involved so I can know what's going on in the community and to meet other agencies that are involved in the community. So right now I just feel like I am like an 8. Hey, Anna, and call me.
I see you.
Sometimes I'm still feeling a little lost on this HMIS stuff, so we're still working through this. But anyway, I'm just happy to be here, and I do want to put a plug out here real quick. On April 27th, we're having our event for our First Impressions, and it's going to be here at our agency, 15 Grand Avenue, from 11 a.m. to 4. You guys, please, you're welcome to come out and bring your families. Thank you.
I'll call. And Beth Rutherford.
Hey, excuse me, I'm sorry. I'm Beth Rutherford. I'm the homeless engagement specialist for the city of Spartanburg. On a scale of 1 to 10, I think I'm like the 9.999, probably 10. Okay, I'll say 10. I feel like between the years with Bruce, Candace, and I, that'd be really bad. I love what UHC has been doing. I think we're getting more and more people involved. Years ago, and I think Bruce and Candace may agree, it was very Greenville centric. And I think that has really changed. For my chapter, it's nice to see that we have now representation from Cherokee, hey Libby, and from Union County. I don't think Stephanie's on the call. And so that's just kind of nice to see that I think it's becoming more and more engaging, and I think we continue to engage more. Thanks.
And Brooks, Bryant?
Good morning, everyone. I am Brooks Bryant with Project Care. I would say I would probably be around about an 8. And I would have to piggyback off of Beth. I think UHC has always and continues to do an excellent job with the CoC. I'm very proud to be a part of it because of that. And I think it really creates a great environment, reaching out, getting new people, asking new people to be involved, to chair committees, to learn more about different committees that make up the CoC. So I think you're doing a wonderful job, and I'm just glad to be a part of it with you.
And Casey Cunningham?
Hello. I am Casey. I'm the grants manager at Safe Harbor, and I'm fairly new to the CoC. I've been at Safe Harbor about 9 months, so I would say maybe a 7. But I feel like the CoC does a good job of having a lot of meetings and ways to get involved when you're new. Being able to join a committee has been helpful for me. So glad to be here.
Yeah. And Jean Vernon?
Good morning. I am Jean Vernon. I'm also with Safe Harbor. I think I'll give myself maybe a 6 right now. I do plan to become a lot more involved because I do try to make sure that I make myself readily available to attend all training opportunities. And I think what my expectations would be is what the Upstate CoC is currently already doing, providing these types of trainings so that we can get to know who our partners are in the community so that we can hopefully eradicate homelessness. Thank you.
And Jessica Davis?
Hey, I'm Jessica Davis with Pendleton Place. I'm a youth housing coordinator. I would say that I'm probably around a 6 or 7, but that I've been trying really hard to step that up, to become more involved. Just like Ms. Vernon said, almost identically, I have joined some committees, and I'm really appreciative that the opportunity is so openly available that we can join committees. Because just like everybody else has said, and I'm just continuing to say that collaboration, communication, and being able to partner with so many great minds has kind of been an asset. I just hope we continue doing that, and that's, I think, all that I would ever suggest.
And Libby G?
Hello. So I'm Libby Cheek. I'm United Way of the Piedmont. I cover Cherokee County. Thanks, Beth, for the call out. I am the community resource coordinator and community health worker for the entire county of Cherokee. And I don't know, gosh, my number of involvement is it varies depending on my schedule. I would love to be a 10, although I miss a few meetings here and there. So I'm going to say that I'm a 6 with room to grow, because I do need to do better. And let's see, being more welcoming. I don't know how they can be more welcoming. Everybody's so open and welcome to new faces and old faces. So I think we do a great job of that at UHC. But I will say, from one of the smaller rural communities, my purpose, my role, and one thing that I would like to see is just more understanding on the Cherokee and Union side of how deep and how much the CoC does. Because I think a lot of times our communities don't really know because there's so few of us involved. So thank you.
All right, and Michelle Murr.
Hi there. Hi there. Yeah, I guess I would say six-ish, maybe. We're in a unique situation that we're the grantee Department of Mental Health, and I'm based in Columbia. So it's certainly hard for me to be in person to a lot of events, but I really appreciate the virtual option on most activities that you all offer, and appreciate that. And I have been to a lot of the trainings recently in person. And I think they've been very well done, and I really appreciate the effort that goes into the coalition building and activities and trainings that the Upstate CoC offers. I think y'all do a really good job, frankly, compared to the rest of the state. That's my opinion from having some experience in all four in our state. So I think you all just do a really good job of that. So I'd say six-ish, something like that. I am on a committee, and I think it's a very, very good committee, the grants committee. We're doing some really good work there, and people participate. We all know that we're all part of a lot of virtual meetings these days, and have been for a while now. And we all know that we sit in some committee meetings and some maybe some staff meetings where people don't say much, but not in this group. People feel very comfortable speaking and providing input, and I think that's a positive. So.
And Nancy Shepherd.
Good morning. I'm Nancy Shepherd. I'm Director of Philanthropy at Pendleton Place. I'd probably put myself right around a 5 or a 6, but I'm excited to grow that, and just will echo everyone else's statements about committees. I mean, that certainly all got me re-engaged as far as sitting on the grants committee. So I'm excited to be more involved in that aspect. And I just think more opportunities like this, where there's opportunity for like open feedback and open forum, especially where staff at all levels of our organization can participate versus maybe the ones that just typically attend meetings.
And Summer Glover.
Good morning, everyone. My name is Summer Glover, and I'm the case manager for homeless service with SHARE. I will rate myself for 9 when it comes to my involvement with the CoC. I think you guys are doing a great job with creating an environment where everyone feels welcome and informed. And we should just continue with these types of training and providing information for everyone. So good job. Thank you.
And Sheila Mooney. Sheila. Star Whitaker.
Good morning. I am with Our Daily Bread for Oconee County. We're a shelter. I'm with the Rapid Rehousing Program. I say I am a 9 out of 9. I think these trainings, the in-person meetings, they're very welcoming. So just as she just said, just feel very welcomed.
Great. Tahir Khan. Tahir. Tim Gordon.
Hey, good morning. I'm Tim Gordon, the Executive Director of Our Daily Rest. I would have to put myself at an 8 with a goal of being 9.5. Busy schedule keeps you on your toes. I think we've done a great job at the Upstate CoC, not only with making people welcome, but with fostering coordination between agencies. Thank you.
Vanessa Johnson. Vanessa. Willow Hinkley.
Hi, I'm Willow. I'm with Project Rest. Project Rest, for those who do not know, is an organization serving victims of domestic violence and sexual assault in Spartanburg, Union, and Cherokee counties. I'm the grant writer, reporter. I'm going to get more into the data management, data integrity part of all of this. Right now, I think my involvement in the CoC is probably like a 6.5. We're trying to like make sure our shelter director is involved, our transitional housing specialist is involved, and our president, and then me kind of filling in some gaps there. I think just to echo the sentiment of everyone, I knew I was going to be like last because my name starts with W, but just echoing what everyone else has said, that the frequency of meetings is great. I think that there's like a really wide variety of content. So it's like there's more beginner stuff that's always happening and then more advanced stuff. So there's kind of a place where everyone can fit in with all of this because it's a lot to understand. So I'm very thankful that as someone who's kind of new to it, there's a lot of opportunity to learn.
And Izzy Rowley. Izzy?
Hello, everyone. My name is Isabel Rowley. I work at the Greenville VA Outpatient Clinic as the HCHV intake coordinator for the transitional house we have here in Greenville. My involvement with the CoC is unfortunately minimal, but I'm trying to attend more of these community meetings to kind of submerge myself and get my name out there as far as a reliable resource for chronically homeless veterans. And I'm happy to be here today.
Thank you, guys. Thank you, guys. I appreciate you making some time for some introductions. Would you guys give me like 30 seconds to a minute to kind of do the computer configuration? Because right now we can't see our Zoom participants here in person. We can only see the presenters. So I'm sorry I'm switching a lot of the shared screens, but it would be nice to get to see you guys too. Minute. Yeah. I think I can do it if I go into like settings.
And Bruce Forbes, you're up.
What is the pain in the-
Movies.
What else could NOFO stand for?
No,
No other opportunity.
That's a good one.
Sometimes that's how you feel.
These kind of feeling. I think this is my second time having this, maybe.
I've never.
Are they
thought about
the
that.
Okay, let's try one before you get a whole bag.
Must be enough there.
I was gonna say happy
All you're gonna
calendar
do is
meeting
pick
for
the
you.
side. If that's what you're doing.
Yeah.
That'll work.
One
But,
item,
but
14.
that.
And then we don't present and have a sidebar up at the same time.
Oh.
Right.
That's
normally
like Jagger
you-
one.
you-
Yeah,
that's
it's
like
pretty good though. We have a lot of popcorn.
I like it.
No, we're
There
not.
we go. Okay, that's it.
We got it.
All right.
On Zoom, can you see the PowerPoint?
Yes.
Yay. Awesome.
Yes.
We'll start one.
Banana?
So this first session is designed to review our 2023 NOFO scoring results and brainstorm some ideas on how we can recover points in this year's NOFO and moving forward. I do have some content to present to you guys, but we'll have opportunities for discussion on each NOFO standard that we talk about today. So please feel free to speak up in person or on Zoom. If you raise your hand on Zoom, I think you come to the top of my little bar and it would be easy for me to see you if you feel like it's difficult to interject, so we can also do that. But really, I want today to be an open opportunity for everybody to ask a question or provide input at any time, so don't feel like you have to wait and hold your questions until the end of today. And really, we're gonna maximize the results of this training day or day of learning if everybody is welcome to participate, because the NOFO score, while it's led by UHC and the grants committee, it's a responsibility of everybody in the continuum. And at the end of the session, the goal is to identify which standards we can quickly recover as a CoC and to have some direction on how we can best implement those targeted actions. I am recording this training, and that's just so that I can take some notes to share with advisory council about what we talked about today next week. For those of you that are newer to the continuum, and maybe don't really know exactly what we're talking about when we're talking about the NOFO. NOFO is an acronym that stands for the Notice of Funding Opportunity. The NOFO itself is actually the written announcement that signifies the beginning of the annual CoC program funding competition. So it's just a document. But when we're talking about the funding competition, we often refer to the whole process, the whole application competition process as the NOFO. So we just use that short little acronym for the whole thing. And the NOFO, as in the whole process, is made up of two parts. First, we have agencies that are seeking funding from the continuum that submit project applications, whether they're applications for a new project or to renew an existing one. And then second, we have the lead agency, also known as the collaborative applicant, which is United Housing Connections, who submits a collaborative application. A collaborative application is a very long narrative-based application that summarizes the work that we're doing as a coalition. So it's not focused on any work of just one single agency. And the collaborative application is what is scored by HUD. So today, when we're talking about scores or we're talking about points lost, it's all in reference to this collaborative application, which again is that narrative about our coalition. So it knows the one agency specific information today. So just a quick overview of 2023. In 2023, we scored 134.75 points out of 200 points possible on our collaborative application. This score was lower than the national median in 2023, which was 151.5. And it was also lower than our score in 2022, which was 159.5. In 2023, we weren't awarded bonus funds to create new projects in tier 2, which means that our CoC's overall score, so our score on our collaborative application, was lower than HUD's cutoff percentile. Unfortunately, they don't tell us exactly what that is. It is a bit of a equation when we're talking about which CoC gets the bonus funds to create new projects. 50% of that decision is our collaborative application score. So while it's not the complete picture of why we didn't get awarded bonus funds to create new projects, it is a huge chunk of it.
Yeah.
The other 40% is where that project falls on our priority listing. And we'll talk about priority listing later today if that's new information for you. And then the remaining 10% is the project's adherence to housing first principles. So really the collaborative applicant piece, our score is the biggest weight in whether or not we're going to get bonus funding. I'll see if I can easily share these with you. So obviously we want to know where we miss points so that we can be really intentional about recovering points so that we can create new projects to help address homelessness in our community. Unfortunately, HUD doesn't give us very specific feedback. That's something that CoCs across the nation keep talking about with HUD, like at their listening sessions and everything. And even this year, they've told us they just don't have the capacity to provide feedback on every single piece of every continuum NOFO every year. And I get that, but it does make it a little bit difficult for us to know what exactly we need to work on. So this is what we get back from HUD when they give us our score. You'll see that it's, divided by a section of the NOFO and then how many points we received out of the maximum points possible. And then we do get this finalizing scoring summary. But like you'll notice, 1C here, so everything that falls under 1C, we got 19.5 out of 29 points. But they don't tell us any breakdown of 1C. So unfortunately, it's difficult for us to directly ascertain what parts of 1C we did not get. So
Do you remember what 1C was?
1C was about coordination and engagement.
Hmm.
So in order to arrive where we are today, where I feel like I can give you a educated guess about where we lost points, I had to compare that PDF we just looked at, the scoring debrief, with the scoring rubric, which comes from the actual NOFO announcement. And so they give us this rubric in the NOFO, so before the competition even starts, that has a more itemized breakdown of the points that we can score. So for example, this would be one single standard, the inclusive structure and participation. And then these are the substandards, so this substandard is worth 2 points. And this substandard is worth 1 point, 1 point, and then on to the next standard. So I had to compare, our application with that debrief document. Because, UHC writes that collaborative application, I was able to know, hey, we weren't able to write that we met 100% coverage in street outreach this year. And that correlates with 3 points on the rubric. It looks like we missed 3 points in that section. And so that's how I'm making these educated guesses. And I'm sharing that because there's no way that I can 100% affirm that all of these are as accurate as possible. It's just come from this process that I believe to be about 90% accurate. It's just not direct from that. All of the content from today is going to be posted on the website. A lot of our content from the last NOFO is actually already on there, like the collaborative application and the priority listing. The only thing that's not on the website was that green PDF, the scoring debrief that we received. That's public in terms of welcome to anybody in our continuum. So if you're interested in looking at that deeper, just let me know. I'm happy to share that with you. It's just not something that we post on our website to face the general public. That's sort of information that's specific to our continuum. So it comes to UHC, but we are more than willing to share it with anybody in the CoC. And so this is what the rest of our content looks like today, and just kind of how this is set up is inclusive structure is the topic. Those yellow points, which are, I apologize, is a little difficult to see here in the room, but I'll read them out. It's 0.25 points. So those yellow points are the points that we missed. So not the points that we got, but the points that we missed. And then the text is the determination of why we missed those 0.25 points. Any questions or anything about like how we arrived at looking at where we lost points or how the slide is set up?
Or does anybody on the call know of organizations that are listed there that we could invite to be a part of our CoC?
Several of these organization types are members of the CoC, but what this question was really looking for was like that heightened participation of, are they voting members, and are they participating in our coordinated entry system, whether they're an access point or receiving referrals.
Gotcha.
Now, could you speak to, just for a minute, in case anyone isn't completely comfortable or can't answer anybody, just to share for the room what constitutes as a participating agency, or like who we would be looking for regarding like that they're specifically primarily serving the homeless population, and kind of what that would look like?
They do not have to be primarily serving people that are homeless. Most of these types of organizations would not be, but the continuum is supposed to be made up of organizations that serve all kinds of different populations. So nobody here would have to be primarily serving the homeless population. We would just look for a representative from one of these types of organizations to be a voting member, or for them to claim to serve as an access point coordinated entry.
Michelle, for the crisis response team, does mental health send out crisis response team, or does that come from the state?
Let's see, the mobile crisis teams, staff are based at mental health centers.
Okay.
They are based at mental health centers. So each of the mental health centers in the upstate region, Greater Greenville, AOP, Spartanburg area, Beckman, I think that's all of them. They would have mobile crisis staff. I think the trick here would be for them to actually be involved. They would have to be, I think if I'm reading this correctly, Natalie, they'd have to be elected as voting members and participate in coordinated entry. Is that right?
The way the application's set up is it's like, these organizations and several others, including like victim service providers, agencies that serve people with HIV/AIDS, school districts, youth service providers. It's this long list, and then there's 3 columns that you check and say, this agency does participate in CoC meetings, click the box. This agency does participate as a voting member, click the box. And then last column is participates in coordinated entry. So we want to maximize as many of those boxes as we can. But clearly, we've done a very good job because we only missed 0.25 points. We got 4.75 out of 5 points for these.
Okay.
So we don't need
Right.
a sweep across the board. It's just what can we do to keep going?
Right. So many voting members, or we're gonna be stepping on each other too, so. I think at this point, if we can just check the boxes that they come to meetings on a regular basis, that'll be really good. And like I said, it's only 0.25 points, so there's probably other areas where we probably need to spend more time on, where we really need to get more points.
Right.
So
Right, but we could certainly, speak to those centers and see if anyone in particular has an interest, in attending, and see what we can do on the mobile crisis. That might help. And local jails, I mean, it just really is tough to get them to come to meetings, right? Because they're usually not able to, but it could be if the local jails are run by counties, maybe a more, for lack of a better word, like management or administrator type at a county that might be over local jails, that might be, worth some time to reach out. Because the jail issue is real, we all know, in our field, to have them more engaged. Just a thought.
I had come up with like a list of some people, some agencies a while back that I didn't know if we'd already reached out or connected with them. But I don't know if anyone has any history with the Upstate LGBT+ chamber. Also, I had Uplift Outreach, which was specifically for LGBTQ+ youth and young adults, which I was wondering if Pendleton maybe already is working with. And then I think I've seen Pride Link and Upstate Pride and HMIS, but I didn't know that they were actually with us, or if we had a history already with them in the past. Those were just some I found.
And P flag too.
P flag.
P flag.
Flag.
That's like, parents. Yeah.
No, I definitely think that those organizations would be interested in partnering. And there's a lot of different ways we could reach out. If you guys wanted, I could try to make that connection for you.
Great.
And just who would be the best person to connect you, like to connect them to?
So, I'll just harp on what you just said. It just makes it so much easier if your organization or you personally already know somebody who would fit this box. If you take that moment to just tell them, hey, I'm a part of the Upstate Continuum of Care, read the website, let me tell you a little bit about what they do. And then just reach out to me and I'll make sure they have that calendar invite. It really just helps make the process really efficient. when all of our partners feel comfortable reaching out and bringing other people in.
Mhm.
Okay, awesome.
What about the human trafficking organizations in the upstate?
We have one downstairs.
Yeah, we have
Yeah.
downstairs, Switch. Their office
Yeah.
is like always blacked out, like they're never there, so I have yet to figure out the best way to get in touch with them. But we'll keep trying.
You know,
That's become, sorry, go ahead.
I'm sorry, Michelle. I was just gonna say, I think I still have their contact info because I had them come speak at Opportunity Hub a couple years ago, so I could reach out to that. I don't know if that person's still there, but it's probably still in my emails.
Is it Jasmine Road too?
I don't remember, but it's in my email, I'm sure.
I thought one, is that
I think
right?
so.
Yeah.
I think they-
What were you gonna
that's
say,
who they
Michelle?
serve.
Well, I was just gonna make the point that human trafficking has become pretty high profile in our state, right? With the Attorney General being so, being such a big advocate. I think they made some news this morning about the need for additional shelter beds for human trafficking victims, which I'm sure we all would support, but might be a nice advocacy opportunity to reach out to them in particular and get them involved with our work. So.
Tim?
Yeah, I just wanted to put it out there that there is the Upstate Human Trafficking Coalition that meets quarterly. I attend that, but we can try and get somebody to pull from that organization in one of the administrators.
Cool.
Great.
That's good.
That's good.
Mm-hmm.
Yeah, Jasmine Road is one of them. I believe Greenville Homeless Alliance is pretty good connection with them.
Yes.
They're on one of their banners.
Yeah.
So somebody there knows somebody at Jasmine
Oh,
Road,
yeah.
so maybe Susan would be able to.
Yeah, I can reach out to her. I think that is, Lisa, is that her name?
That'd be perfect.
Hey, this is Beth. I'm in my car, so hopefully you can hear me. We are working on, there's an LGBTQ budgeting group here, so we're making contact with them. And also, I think Willow probably could speak better to this, but we discussed all of this in our last chapter meeting. And I don't know if this works, but like Project Rest has said they've kind of worked with some human trafficking people. I think, like I said, Willow could speak better to that, but I wonder if that would work as well.
I'm a little particular about including somebody. I would expect for it to be an agency that's in their mission statement. Because just if HUD ever came back to us and said, prove to me that you work with agencies that serve survivors of human trafficking, I'd want to be able to point to a super specific agency.
That makes sense.
Okay.
I feel like, I was just gonna say, I could probably reach out to Clint too. I think Myrtle Beach is like top 2 in the entire nation for like highest prevalence of human trafficking in the entire US. He might have some, or Julie up there, and they might have some that kind of stretch down into the upstate as well.
We'll keep rolling. We got lots of points to get to. Coordination and engagement was a very large one. We scored 19.5 out of 29 points possible, so we did lose 9.5 points to get us started on a good note. In the past year, you will know this if you came to our spring training, the CoC held a mandatory / optional training for members on the equal access rule and on preventing involuntary family separation. And we should be able to immediately recover 3 points because we held that training this year. That's great. Our CoC is asked to indicate coordination with other federal, state, and local governments, private, and other organizations that are included in the planning or operation of projects. We were able to list many that we do involve. The ones that we were not able to indicate that we currently coordinate with, and I mean coordinate as in planning and operating our projects, are the Indian tribes and tribally designated housing entities, and I'm not sure why the specific DSS program was listed there, but the TAMP program for DSS.
Yeah, we definitely need some, I can reach out and invite somebody from DSS over that program. I want to invite the state, DSS for the child care voucher anyway. And I can look at this specific, program too. Yeah. This is also called FI sometimes, family independence.
Is anyone aware of or have a connection with a Indian tribe or a tribal organization? After my research, I was only able to find that one exists in Duncan.
In Gordon does.
And one exists in Lawrence. Yeah, Tim?
But are they recognized though? Doesn't
Yeah.
it only count if they're recognized?
Yeah, those were the federal, one of them was federally recognized and one was like state recognized.
Okay, great.
Yeah, the Cherokee Nation has a outpost or an office in Walhalla. So I'm trying to contact them and then see if I can get them pulled in. The question is, at what level? Like if they get involved with the Tri-County, is that enough to count them as involved, or
Yes.
do they need to be on the upstate committees?
Tri-County would be perfect.
Okay, so I'm working on that.
So we lost 9.5 points just because of a lack of coordination with these two bullets? That's the way you interpret that?
I've got a couple more slides that fall under the coordination and engagement 9.5.
Okay, got it.
Yeah, that's okay. So we're still under the same 9.5 points. We're asked to demonstrate that the CoC coordinates to provide education services to families with children between the ages of 0 to 5. And collaborates with education providers, local educational authorities, and school districts. And I mean, we have fantastic relationships with representatives from school districts, our McKinney-Vento counselors. But just these programs, they want to see our CoC funded programs having written formal agreements with the following,
Mixos has a written formal agreement with Head Start program at, Gleams.
What do they want on those written formal agreements?
That
Is there any-
your folks will take precedent over others.
Okay, because I'm not sure, but I'm pretty positive that I could get shares, Head Start, early Head Start in the 4 counties that we serve, Greenville, Anderson, Pickens, and Oconee counties. To get written formal agreements. We're already doing it. It's just not written formal.
Ours was in the form of a match. I'm not sure if we missed that one or not, must have, but
But sure we
it's
would
in,
honor that.
it's in the form of a match requirement.
Does United Housing Connections not have a written formal agreement with the McKinney-Vento program?
No, I don't think you would have to have that. That's like a mandate for every school has to have a, but we should for, Greenville County for Home Again.
Right.
Yeah, but
Yeah.
that's not CoC funded.
I don't think it matters.
Oh, okay.
Do you?
Well, as long as we're represented in each county, I know that we're actively involved with Oconee County's McKinney-Vento. I can easily get a memorandum of understanding with her, but each county should be able to do the same.
so this one, just for a little more specific context, was about programs that are funded by the CoC. So I'm
Okay.
talking PSH, rep housing,
Mhm.
et cetera.
So
That category.
in the Meg's house one, it said, that they would match like $8,000 in childcare education. So, yeah, I think even the home visits, that could be, even the nursing program from the doctor's office. If it was specific to the program.
Yeah.
Something to work on.
We might want to reach out to First Steps too, a state agency. So that would be a state, another state partnership, and see what could be done for specific assistance in the upstate. Just a thought.
I have great connections with First Steps. I did connecting with you. I didn't
Right.
even have First Steps.
Sorry. Oh, I'm sorry, I couldn't hear that. I'm sorry.
Oh, I just said, I have some close friends who are, on the leadership team over there, and I.
Okay. Great.
With Natalie.
Yeah, I have a good connection that used to be involved with the lead agency in this area who now works at First Steps here in Columbia at the state office as well. So just that might be helpful.
Keep rolling. Last one for coordination and engagement, so still under those 9.5 points. Our CoC must coordinate it with public housing agencies. We were not able to attest to 2023 that we ensure that at least 20% of new PHA admissions were individuals or families experiencing homelessness at admission. And we don't have the following PHA programs participating in or receiving for referrals from our coordinated entry system. As far as providing documentation of that 20%, what we're asked to do is provide 2 PHAs, so 2 housing authorities in our geography as in a sample. And kind of historically, we've done Greenville and Spartanburg, but they both do report a general and limited homeless preference. But they typically report less than 10% of admissions were homeless at entry. So we're not quite at that 20%. And a general preference means that they put anybody experiencing homelessness at or near the top of the waiting list. And a limited preference provides a specific number of slots to households that are homeless.
Can you say that last part again?
Yeah, so a limited preference means they provide a specific number of program slots. So they like allocate a certain number of their vouchers to people that are experiencing homelessness.
Thank you.
So Natalie, so Natalie, this is Bruce, just want to give everybody a heads up that the South Carolina Interagency Council on Homelessness, our leadership, we're meeting with public housing authorities across the state on May 7th. HUD is helping to promote that meeting because we all know that we need to have that collaboration between COCs and public housing authorities. And so we're hoping to begin the dialogue of kind of creating some of these understandings and agreements. So hopefully now to be able to create 20%, come on now, that's kind of absurd. But we're gonna hear about what the current PHAs have. I've read a document that basically said, this was back in 2014, that HUD surveyed all the housing authorities across the country. And it was really, the really large PHAs were the ones that were able to do these preferences because they just had more units to be able to offer. The smaller ones are just, you know, trying to keep their head above water. So it'll be a good meeting and it'll begin, we will be able to say something at our next NOFO for sure.
Yeah, Bruce, it might be good if someone raises this particular part of the collaborative application. A lot of the PHA's leadership may not even know that this is something that COCs are having to report on.
Exactly.
That could be, and we may be losing points that leads to less resources. I mean, they literally may not know, right?
Right. I mean, at 20% of admissions is just,
right.
You know.
I'm kind of interested in the second bullet. So they actually are asking whether or not PHAs are actually like using the CoC coordinated entry system to make referrals to these programs. Is that right?
Yes, as in serving families that are coming from our CoC's coordinated entry system prioritization list.
And I mean, you know, the point is sometimes you think that is what, but you know, I think if we think about it, that housing urban development has continuum of care housing and housing authority. I mean, they are in fact over the housing authority. So why wouldn't they want us to play together, you know? So
they don't have to say, I'm only going to pull people from coordinated entry for my family unification program. They could tell us, 2 times a year, I'll give you 1 slot, you know, if that's the capacity that they can give us, that would meet this requirement.
Yeah. Yeah, it's just that's not necessarily a good fit, coordinated entry with the way Section 8 vouchers are administered. That's all. So it's interesting that HUD is asking about this. But what would be interesting, Candace, is if we could talk to, for example, Greenville or Spartanburg Housing Authority and ask them to how we could put people in some of our I'm just using us as an example, it could be others, some of our PSH program participants on their wait list for mainstream vouchers. You know, so when there is a vacancy, they could accept people from our programs. Would that count, Natalie?
Yes.
Oh, it would. Okay.
From our PSH wait list on
From
theirs. Yeah.
From our
For their wait list, but as our program participants come up on their wait list and they are able to get a voucher, then we can serve someone else. Mainstream vouchers would be a nice fit.
Well,
That's not.
one of the things too is that I think it comes from understanding. Because like, you know, when I've met with the interim director here, one of the things that, you know, it says basically that, you know, the housing authority doesn't have the authority to enter into like this memorandum of agreement like that, which we have had over time. We've had them, you know, through different CEOs. And I think too, just knowing like, yes, HUD wants us to work together. One of the things I also learned over my time is that every housing authority is supposed to have a homeless preference and to help those first, but they don't. And, so I don't know, maybe, and I've asked for the interim to come to that meeting. I'm gonna ask the Greenwood Housing Authority Director too, but, I know
And
it's.
Spartanburg as well. They've done a lot of work in this
Yeah.
area.
The interim here was from Spartanburg too, so, but just letting them know, hey, HUD wants us to work together. How can we make this happen?
Right.
Obviously, you need a memorandum of agreement so everybody understands what's going on, what to do, but.
Right. Well, you're saying that you're inviting them to this meeting in May?
Well, I invited, the interim here. And they didn't want to get into, because at that meeting in May, you have to commit to some things, a few things, so she didn't want to do that long term, but I am gonna invite one from Greenwood, so, yeah.
Oh, the meeting that Bruce was referenced? Oh, I didn't, I mean, I hope that there will be some commitments that come out of it, but I don't know if that's required.
On the questionnaire, there was some questions, there was some, you know, commitments, like how often would you be able to meet or something like that.
Oh, yeah. But no, I mean, it's just to talk about these issues, you know, and for HUD to be really clear what they are strongly encouraging. So, but yeah, okay. This is good. This has kind of us thinking a little bit beyond what we're doing already with housing authorities. So
It would be good to get.
It's good discussion.
more housing authorities on board.
Yeah.
In general, because, I mean, we got Anderson Housing Authority that has been off and on about playing ball.
You got the regional.
You got the regional, I mean, especially because of the fact that our CoC covers so much outlying areas and so forth. They don't fall under a lot of the local housing authorities. They fall underneath the regional housing authorities. So that would have a major impact on our CoC and what we could reach out to.
That's why we're hopeful for the meeting in May, in that dialogue.
And I think there's also going to be some follow-up at the state association meeting later in the year as well, which is their association that apparently, you know, we're going to have some time with them then. So I think there's at least some willingness to listen, which is good.
Cool.
Street outreach coverage was worth 3 points total. We scored 0 out of 3 points on this one. The CoC must describe how our street outreach programs covers 100% of our geographic area. And last year we
Thomas,
weren't
get out.
able to account for street outreach in the following counties. I say that not to say that street outreach does not exist in these counties.
One time a year.
Yeah.
One
Pitt
time a
County,
year.
yeah.
Pitt County.
Yeah, it's just, you know, are these persons who are conducting the street outreach coming to the CoC where everybody publicly knows about them? I was able to meet with a South Carolina Department of Employment and Workforce Rural Outreach Coordinator, last month. Her position is new. Her name was Mary Baker, and she's covering all of the counties that have got starred. So she would certainly help with this standard, and is really interested about coming to our advisory council meetings and everything. So that's great. Really what we're looking for left is Pickens County, Edgefield County, and Saluda. Of course, we welcome anybody who covers any of these other counties, you know.
Now, don't some of the veteran organizations do outreach pretty much in all those counties?
Well, no, I've asked about, some of them coming during the pit count for the upstate, I mean, for like Edgefield and those type areas and just due to capacity, but that was way back. So maybe now.
I mean, so organizations like Upstate Warrior Solution, who has outreach advocates
Yeah,
in
all those counties,
in
right?
Pickens, Lawrence. They don't go as far as Abbeville, or they haven't in the
Yeah,
past.
in
They may-
Edgefield, I
they-
mean,
They might be reaching out that way, but their advocates are outreach coordinators.
Right.
So that might be somebody that we could talk to, and they would know, plus the SCDVA. South Carolina Department of Veteran Affairs, they have that outreach and supports in all of those counties.
So how is it
So-
proven through HMIS? Is that how it's proven? Like, do they have to be with?
It's just an attestation that
Oh, okay.
we have street outreach providers
Oh, okay.
participating in our continuum that cover 100% of geography.
Okay.
I mean, that might be a good.
I mean,
good way.
Yeah.
Yeah, more than
Upstate
anything,
Warrior
they know to call us if they find somebody, right? That's the key. Doesn't matter who the organization is,
Yeah.
and they're doing outreach, you know.
I don't know who that is.
For-
Okay.
yeah. So we can talk, we know people. I know people.
Yeah, we should be able to.
It would be pretty easier connections to make,
Yeah.
the easy one for us.
Rural communities, it's not really street outreach, it's more like dirt road outreach, right?
Hey, trust me, I've been in those.
Yeah, I know. It's
Alright, public health.
pathways in the woods outreach.
Public health agencies, we scored 3 out of 5 points, so we missed 2 points. They want to see that the CoC coordinates with state and local public health agencies to respond to and prevent infectious disease outbreaks amongst people experiencing homelessness. I really don't know why we missed 2 points here. I really don't know how to improve this standard. But my only conclusion is that we lost points because what we wrote was a response or a summary of how our community responded to COVID. I think they want to see maybe a more general plan, but I
Yeah.
don't really know anything about
One of the
about what the
things
general plan
that
would be.
we could talk about, is that in Greenwood, the United Way there, Sandra Calvo and those. I mean, I'm thinking they're trying to continue this. They have a rural health grant. And so one of the things, I mean, I presented too with, on domestic violence back then, but they had somebody from DHEC and different places presenting on syphilis and the spread of syphilis and HIV and things like that. And who knew that syphilis was so rampant in the nursing homes? Did you know that, Stephanie? Yeah. So we could talk more about that. And they had, data walks.
Was that Tim?
Public health and homelessness, so.
Yeah, I was just wondering how much of this is just a simple matter of reporting, because I know that we have a memorandum of understanding with the public health nurse through DHEC in Oconee County, our shelter does, and they come quarterly to give immunization shots for flu, Hep C, all that stuff.
Okay.
And what about our healthcare for the homeless program too?
Yeah.
Right.
What is that?
Healthcare
Right.
homeless program that Brandon Cook used to do over at New
Oh,
Horizons.
you're right. Yeah.
I was gonna mention that too, Bruce. Yeah,
So
it's
a lot
just
of- you know, a lot of
Brandon
these
only.
points is changing how we write the NOFO each year. You know, we can't trust one person to know about everything that we offer in the continuum. We can't trust the grants committee or the executive committee to know everything that we offer in the continuum. So I think maybe this year, something new we can try, as part of the NOFO process is sectioning off some time in advisory council. Saying these are things that we're missing. Can anybody, you know, shoot me an email if you can cover them?
That's what we do to do it, the grants committee,
Good idea.
through the application, but it would be good to do it, you know, on a continuum basis.
We get better every year.
Yeah.
Cool. We're close to 200 points now.
Yeah. And bonuses.
Right.
All right, advancing racial equity. I am super proud of what we were able to talk about with this standard this year. We scored 6.5 out of 7. And so we only lost 0.5 points. I think the missing key is that we just need to conduct another racial equity analysis. Nowhere does HUD require that we do it every 3 years. But in the NOFO, did they ask, have you conducted one in the last 3 years? So I think that's our nudge of we should be doing that.
Gotcha.
How
How difficult is that to do?
Not difficult.
Okay.
There's like a whole tool.
Oh, okay.
all that stuff.
Okay.
So we
cool.
talked a lot about that at the NHSDC conference, about
Okay.
some other organizations, how they've been able to.
Cool.
Well, it's kind of like releases like a drag and drop tool for us. It's so easy.
Okay,
You
cool.
know, we can
So
probably
we're
do it
gonna
every
do
year.
Should be done by tomorrow. Excellent.
We're gonna do one. So we'll be able to talk about that in the next NOFO. That's gonna be, you know, something that the CoC staff can take on. But we're gonna check out the one that already exists for 2019 on our website. We're gonna produce something kind of similar to that and really help take it to the next step by sharing it with our DEIB committee so that they can see it and have it as kind of like the foundation of where we're at right now.
Sounds good.
No, that's great. Cool.
Let's do 5 minutes, and come back. So I know 2 hours is a lot.
Okay.
So 11:15.
All right.
5 minutes, okay.
That's all you get. No more.
We got more to talk about.
Good job, Natalie. Thank you. Gotta ram into it. Good.
I just emailed you.
Thank you.
It's a system-wide issue, but I'm almost there. I got the, well, so I got the new, the data completeness report.
Yeah.
But then it's still having problems. The new version, the same problem.
Said I was just glad it's not so.
It's not, you're not the problem per usual, it's HUD, or, well, not HUD, but Well Sky.
So I have.
Working on that,
Cool.
yeah.
Oh, yeah, that's what I said. I'm like, I'm sure it's.
He wants to.
Locally.
Things we need to.
Yeah, and that's
one more.
primarily what I've
Okay.
been doing is rerunning that
Okay,
report,
so we
because I
can-
just pulled new copies, so I was talking to Mock CoC, who has one that's supposedly functioning. So I was able to look theirs and see, and she was like, I have no idea what the difference between yours and mine, because we all created them together, but hers was working, but I still ran it when I'm on a CoC.
And I think.
And it's like
we need
down,
to
like across the
actually-
board, health insurance, null 9.
Yeah,
Or
and
ends
go down and.
And,
I know I'd like to go.
I verified and cross verified. with those are covered. And I sent one to Austin Oaks to do that yesterday. I said, hey, I know that this is probably wrong, but here's the rest. your students, so I need to the side.
I'm gonna go get some chips now.
Should I, have you read it yet?
Yes, it is, Jim.
Go write your Eva.
Okay.
It's way better than that anyway. Your Eva will be like your end all be all, because I'll tell you why. It's your data quality, data completeness, everything in preparation for LSH, and
Okay,
it does all the federal reports for that.
good.
So, yeah, everything in there will be good. The only thing that like isn't on that like data quality export is client count. So it's on the email, it's just a separate download. So go play with it.
Okay, yeah.
But I would say just use that. I'm really pleasing out of the OG5 total report, because it's like, did you answer the question, yes or no? But it doesn't say the question.
Right.
But it's supposed to, you know, to the point of.
Send you a virtual thumbs up.
In regards to federal. But it has all the.
Natalie,
data
you need me to be
points
here for
throughout
the
year.
newbie
I'm
training?
slowly going.
Okay,
through.
I was gonna come
I've
for the,
gotten
I
to part-
was gonna come for the expansion.
But,
Backup of information.
where I ran,
but
but I've been like, hey, please just be recorded,
Okay.
what to do. But I'm still kind of.
Is
working
Angela
through
the
everyone.
from,
First impression, Sandra Bullock.
oh, I thought she was from.
Yeah, do
the
that for
old
now,
AIM.
but
Is that
I'm
right?
working on that because
Okay.
it's still
Mhm.
a part of our tool
Yeah.
for EH.
I don't believe she was
That was
with her.
Lockhart, that was Lockhart, okay.
Yes.
And then
Mhm.
if we ever make a change, it'll be a year after, you know, for that
Very good.
verbiage.
Yeah.
So we gotta fix that report anyway. I'm fine, but I read it like 5 times today. And it just isn't doing it.
Yeah. Not playing.
Just does
Yeah.
not want to.
Okay.
I don't.
Well,
get
you
it,
got-
but,
okay.
yeah.
I got the, well, I got, you know. I got peanut butter too.
I wouldn't say that I love it.
It's a love thing.
It's a love.
Good business relationship. But yeah, for sure, but.
I don't think I've seen these before, but they're pretty good.
Yeah, you're welcome. I just. I don't know what's going on, but we got a lot of people learning interviews
Yeah.
for business objects, not just OT5.
Always
I
something.
know, I know.
Are you learning? I mean, at home.
Yeah, yeah.
We keep rolling.
I got two things here that you
Project rating tools. We do very well with our rating tools. We scored 18 out of 21 points. So we only lost 3 points with the rating tools. Our CoC has 2 rating tools to rate our applicants competitively, one for new projects and one for renewing projects. New in 2023, so for the first time last year, our rating tools must have a standard that awards points to projects based on the degree to which the project has identified any barriers to participation, faced by persons of different races and ethnicities, particularly those overrepresented in our local homeless population, and has taken or will take steps to eliminate those identified barriers. This is something that the grants committee is actively working on. You know, that wording, it's a challenge. There's no real black and white or data way to identify who's doing this. So, you know, we're continuing some discussion on what the standard would look like. We hope to have this implemented this year. We've decided as a committee that if we don't have our rating tools edited and complete by May, then we're going to push it out to next year because we don't want it to cut too close to this year's NOFO. So hopefully we'll have it this year. If not, we should be able to recover those 3 points next year, because I don't see this standard going. HMIS utilization rates. This is a really tricky one for us. So we scored 0.5 out of 4 points possible. So we lost 3.5 points. In order to get full points, the CoC must have 85% HMIS utilization rates for the following project types. And so I've listed the project types and our percentages from 2023. And what this means is out of all of the emergency shelters in the entire 13 counties of the upstate that we include on the HIC, what percentage of them is on HMIS? And we just don't have these for a variety of reasons. And in order to recover partial points, we have to write out a detailed plan of how we're gonna reach that 85%. But obviously that doesn't recover a whole lot of points because we only got 0.5 out of 4, even though we had 3 out of the 5 housing types.
Who's the transitional housing that we don't have HMIS connection with?
The Dream Center in Pickens County, Connie Maxwell House in Greenwood, and Hub Transitions in Greenwood, which I think
And-
would be an easy game.
And Phoenix. Rising.
Yeah, so there's several providers. I've got a couple for each section based on big bed quantities. So like Phoenix Rising, I think they report typically around 10. Those other places are more like 20, 30.
Connie Maxwell was on HMIS at one point, so.
Is, the emergency shelter is not worth going after at the moment. But transitional housing might be worth trying to get up to 85, right?
Yeah, for those of you that don't know that history, it's gonna be super difficult for our CoC to get to that 85% in the emergency shelter category. And that's because Miracle Hill Ministries, which operates shelters in Greenville, Spartanburg, Cherokee, they have huge quantities of beds, and they have their own database that they utilize and have consistently not been interested in joining HMIS because they just serve so many people and their database doesn't require as much from them. I don't blame them. But without them, we would not reach that 85%. So it's something that we have to keep on our radar of, how, is there anything we can do to build that bridge? But yeah, I think focusing on transitional housing will be good. And unfortunately, we'll lose permanent supportive housing starting this year because HUD Dash is no longer participating in HMIS and they're not required to.
Really?
Yeah. We'll keep trying with them as well. It's the, current staffing there decided they didn't have the capacity to keep up with what we require from all of our end users and all of our agencies. As new people come, maybe their organization changes, their organization grows, we're gonna keep that line of communication open to see if we can build it up again.
How many beds is that guesstimated?
211,
Oh, my.
and that excludes, that's 211 documented veterans, and they don't actually track information on their families, so there's even more. If they actually tracked their households, there'd be
Wow.
more than that. Like, there'd be more people,
Right.
but historically it was 185. The last few years.
Okay. This is maybe an area where, be interesting to find out from HUD how other COCs, what their HMIS utilization rates are. I can't imagine everybody in a particular geographic region says, oh, please, I just want to be on HMIS and in all of the different bed areas, without getting, especially without getting any HUD dollars of any kind. And unless others are just saying, well, we're only including those organizations that receive HUD dollars.
It's probably pretty, maybe collateral, general across the board.
I will say that all 3 of the other COCs in our state have also opted, are on the same boat where their VA has not had the capacity or interest in maintaining the baseline data quality standards we need to have them. And some of them pushed them out themselves because the data quality that they had, if they are in there, impact greater than the lack of utilization rate. So it hit us really hard on SPMs and LSAs.
Yeah.
And if you have unusable data, that's more points taken away compared to sometimes that smaller utilization rate. So everyone in the state of South Carolina is in the same boat. Ours just hits now because everyone else has this is a difference from the hit
Yeah.
to the next year. That's a little deeper out,
Yeah,
a little.
I just think this is a standard that's kind of unreasonable. But you should really get great utilization from everybody that's receiving, HUD dollars, whether it's ESG or CoC. And that should definitely be measured, but this one to force people who aren't even wanting to play the game, it's just kind of silly, but it's only 3.5 points, so.
Yeah.
And there's not a whole lot we can do about it, so.
So Anna, I mean, it sounds like the VA is not required to participate in HMIS, right?
The VA is required to participate in HMIS and select projects, so, I could go into that in more detail, but some of their projects are specifically HUD-VASH, no. The VA
Right.
overall is required to participate in coordinated entry. And some of the projects, for example, that are required would be like their rapid rehousing program. But it is important to note that their manuals and the way they operate those does differ from CoC and ESG funded projects. So if anyone's curious, you can just Google the SSVF program manual or any of those project manuals, because they look pretty different from like a standard CoC rapid rehousing project, especially with the length of time and the services that are required to be served.
Right.
So HUD-VASH just looks a little different. And
HUD-VASH, right. HUD-VASH is
yeah.
not required to participate in HMIS.
Yeah, not the VA as a whole, just that project.
Yeah. Yeah, that's interesting, isn't it? Because a lot of the other programs it's actually required to participate in HMIS, and this particular project, and for it to hurt COCs. Yeah, that's not okay.
Yeah, and that was brought up at NHSDC in a lot of our sessions.
Great.
For like the HMIS specific sessions, and not just specifically HUD-VASH, but all housing vouchers. Most housing voucher programs are not represented in HMIS in the way that we would like them to be, but HUD-VASH falls under a housing voucher, so it's kind of that category of services.
Yeah.
That we see a deficit across the entire United States, not just.
Right, that's probably the issue, is that they're administered by housing authorities. And housing authorities are not required to be in HMIS either, so for all like Section 8 mainstream vouchers, none of that is required. Even EHVs were not, right? Is that right, Anna? EHVs were not in HMIS either, right?
Yeah.
Okay, great, thanks.
All right, thanks.
Just one last thing about the HMIS utilization rates, like we said, it's really hard to convince people that aren't required to use HMIS to use HMIS. There are a number of benefits, and it's really good at convincing people about those benefits. But I think another step that we can take to add to that persuasion is if they see a neighboring organization using it. So like in Anderson, if Hope Missions could help us reach out to an agency out there that's not using it, like the Salvation Army of Anderson, and say, hey, we know you, we've always collaborated together, we use HMIS, here's what we think is good about it. Just it helps add to that conversation. Yes.
All right, here's a biggie.
Point in time. So at this point and forward in the itemized points, we're in the system performance bracket. And it's really difficult for me to flesh out, exactly where we gained points. I do just know the total points that we lost, which I can match up to these categories. So I can tell you, we lost 12 points for point in time count reasons. But I can't say we scored, 3 out of 5 or 10 out of 12. I just know the points that we lost from here on out.
Big difference in the
Yep.
shelter.
There's some massive points connected to the pit count. 2 points for a 5% decrease in your shelter population, 7 points for a 5% decrease in unsheltered population, and on top of that, 3 points for a 5% decrease overall. It's been a while since we've done that, and we didn't do it this year, so we're not, we won't do it on this NOFO.
Yeah, I think we're just up against demographics. So many people moving to South Carolina and the upstate. It's gonna be an uphill battle for this one.
And we get better at conducting the pit count every year.
Right.
You know, throughout the year, HUD asks us, do as good as you can, counting as many people as possible in the pit count. And so we find more agencies and train more volunteers. and We count more people, and then we're penalized in this way for counting more.
Right.
People.
Just need to hire blind out workers.
Just touch
So
it.
they can't find anybody.
I mean, they can't touch them, they can't
Get
get.
a big erratic drop.
Right. I mean, it just bothers me that the assumption that if you have X number of people who are homeless on that particular day in January, and then you add housing programs, let's say, and you add new people to programs, when they have vacancies, you fill them and all of a sudden your homeless numbers are going to go down. I mean,
Right.
that's not the way this field works. I mean, people are becoming homeless, people are coming in, people are leaving. I mean, it's an interesting, to lose 12, that's 12 points,
Mhm.
That's not 2 or 3 points, so it's really frustrating. That's all. I agree with all the comments, because, actually, we know those counts are even still low, right? Even that unsheltered number of 615 is still low. But that doesn't mean that we're not, as a continuum, assisting people every day, and even new people every day. So anyhow, it's just frustrating to lose that many points.
And, for persons who are newer to the continuum, or maybe just don't know, every CoC across the nation, there's a pit count. And the information that's collected in the pit count is shared to HUD. And HUD creates the AR, which is the Annual Homeless Assessment Report, which they share with Congress, which is where they decide how much money is going to be available nationally to create programs for people experiencing homelessness. So really being as accurate as we can and counting as many people as we can in the long run.
Better.
Helps our mission. It's a hard blow to take as a single CoC. It's, part of the big picture.
Good point. This time. It counts.
So the system performance measures, I know I said we're in the system performance measure bracket. For clarity, at this point, I am talking about the assistance performance measures report, which is a specific report that UHC submits to HUD annually. So these next two slides include some system performance measures standards that are included on our actual report submitted to HUD. The system performance measures are 7 measures, and they include things like how many people in HMIS are experiencing homelessness for the first time, how many people total, how many people are returning to homelessness within 6 months up to 2 years, how many people are exiting your projects with a higher income than they came in, how long are people homeless, successful placements out of projects, and all this information comes from HMIS. So this report specifically focuses on our agencies that use HMIS. We lost 8 out of the 18 points for reducing. You could get 8 points for reducing the average length of time homeless by at least 5%. This is calculated by the number of days people spend in HMIS, emergency shelters, and safe havens. So we won't gain these points back this year because we already know what our system performance measures are. A big weight on this number is our safe haven. We're the only CoC in South Carolina that has a safe haven, and the people that have been there for a very long time. Of the 12 people that are currently in UHC's safe haven, their average length of time is 2,075 days homeless. So of course that number is going to increase every year, and it's kind of like this weighted chain that we drag, where all of our other providers can hustle, turn people out of shelter as quickly as we can, but we continue to drag that weight of safe haven. Candace and I have talked about this a good bit. It's something that we need to prioritize, and it's not all that hard to do. In the NOFO, what we can do is apply for it to be a transition grant, which is a very HUD setup, easy way to do it, where you would have 1 year to change your project component to another component.
To like PSA.
So we could change
Okay.
from safe haven to PSH, and it would knock those 12 people with 2,000 average time days out of this calculation.
Now, that's just smart, and why they call safe haven shelter is just silly. Because it's designed for permanent housing, so, but anyways, that's another HUD thing. That's good, you guys should definitely do that, and hopefully
Yeah.
agree.
Gene asked if capturing data from agencies who are not using HMIS. So this measure right here is specifically from our system performance measures report, which we can only run on HMIS at this time. So it's like a HMIS extraction that we submit to HUD. So it does only include projects that are on HMIS. Or the victim service provider, no, yes?
Not BSB. The main reason like behind it, just I think that simplifies this is that you have to have a certain level of data quality to be able to use the data. And the way that we monitor, making sure we don't have duplicate people, so not 5 John Does who use 5 different service providers, is by having them in the system, and that's why there's such a big push. Because they do get excluded from the overall data about our community when they can't maintain the baseline, they call them the UDEs, so the universal data elements, to be able to deduplicate and verify the individual people in those programs. So we can't include that, even if we asked them, hey, can you tell us how many people were in your shelter through the HIT, or how many people were there at the PIT count? It can't be included in that way because they don't have enough identifiable information to be able to deduplicate those people for the purposes of this measure.
The DV shelters you're talking about.
DV
Yes.
shelter's different. They have their own whole set of rules about what they can and can't share, and I'll talk to you about that outside of this meeting if you'd like to know.
But they're not included in.
They are
system
not included in
performance.
this, that's correct, yeah. They have totally separate rules, even de-identified information we can't share. Because if we had one person with 5 kids in Oconee County who was a victim, someone could still say, oh, well, there's only one person with 5 kids in the county, that's probably my person I'm looking to find. So it's a safety concern. I just, it's an example, not a real person.
So Natalie, I just had a quick question about the safe haven. Is there a reason why that hasn't been changed in the past? Moved, or I guess changed the component type on the safe haven from a safe haven to a PSH. Do you know why that hasn't happened? Because this has been in the collaborative applicant for application for a while, right?
Yeah, it's UHC's grant, so it's
Right.
UHC's decision to do that.
Right.
I would not be able to provide any more than that, because last year was my first NOFO, this
Right.
is, the first time I'm hearing about it.
I just didn't know, did it come up last year?
I don't think we've been able to make the transition. I think this may be something new that HUD's allowing.
Well, Lorraine did talk about it before when she was here, even in the NOFO, and I think it's just, because we're going to go through a grant agreement amendment right now for another grant, and I know that it's just not as easy as it used to be, but definitely it's something that, we're gonna look at and what is attached to the grant, the way, how it is. And, so, just be looking at that, because we know it does have a collateral effect. But honestly, I think that sometimes because of, the day-to-day and everything going on, y'all know how it is when the NOFA drops, you're like trying to get all your stuff, and it's just renew it without even taking the time.
Yeah, and you
to look at
can't
it.
do anything usually during the NOFO competition, right? So you have to wait, and then before you know it, it's back again. I was just curious if there were any reasons why if there was a downside to it, and it,
I'm
we
sure
got
there
stuck,
is.
which has happened before on projects when we tried to make changes. So we could we could ask Angie to walk through it with us, pros and cons. See if she can help us, she will. Just a thought. Okay, great.
Thank you.
You could gain up to 6 points for increasing the rate at which persons exiting from rapid rehousing, transitional housing, emergency shelter and safe haven projects exit to permanent housing, increasing that rate by 2%. We didn't do it last year, so that in the 2022 system performance measures, we dropped just a little bit, but we picked it back up this year, and so we should get those 6 points.
Can I say just one point on this too? I've talked to a lot of you guys about this, but it's really important that you read your program manuals that HUD provides and try to operate in the way that they're intended. And what I mean by that is that I know that not everything is completely perfect, but a lot of the policies are put in place to decrease the rates of return to homelessness, which is pulled through the system. We can tell when John Doe leaves your program and they return 6 months, 1 year, and 2 years out. If you provide the case management components and follow through with that, this can be greatly reduced. So much so that it's been a continual conversation piece, not only at our conference, but in a lot of the HUD sessions. So I really urge you guys to know what the time frame of your program is expected to be and the additional components of that. So if you have people in your shelter who've been there 2 or 3 years and aren't resolving their housing, I really encourage you, or rapid rehousing where you're not providing the case management that's intended with that program type. I really encourage you guys to really take a look and see about what you guys can do operationally to improve those. I think that if we fixed the handful of projects that really struggled with that, we would see a monumental increase in performance and a huge decrease in returns to homelessness, because that does push that time frame out. For example, if you have 6 months of case management beyond your financial support, or if you exit a shelter person who may not be suitable for rapid rehousing or PSH and help them find another solution, that can help the entire continuum immensely. So I just urge you guys to use the resources that are available to you, because they really matter for us as a team.
I have something to build off that. That's a really good point. And also, I think that it speaks to the point that Bruce made earlier about us bringing in more partners who do more than just the types of housing opportunities that our programs serve. Bringing in people who can assist people with the things that they need in order to be put into permanent housing on their own. So help with finding a job or daycare or transportation or mental health services or whatever the case may be. If we can bring in partners who actually focus on those things, that kind of takes some of the responsibility off the case managers, because I know case managers are busy and stressed. So if we had some partners who could come to the table and come in and help serve those folks, then that would kind of level out the playing field a little bit and get that result that we're looking for.
Yeah, we know it's not perfect and we're all at a disparity and there's nowhere to put them. But
Yeah.
I think those things, just knowing like kind of what's expected, I think really helps with this specific measure. Because there are some things you can do to kind of work around this or to buy your clients more time. Before we throw them back to the wolves.
One more slide on the 18 points from our systems performance measure report. Up to 2 points for increasing the percentage of persons who had an increase in employment income, or that your rate was 20% or higher. That is a lofty goal. I'm really not sure whether they are looking at this measure from our stayers or our leavers. Stayers mean somebody who is entered your project and is still in your project at the time this report is pulled, and leavers mean somebody that you served during this time frame, but they're no longer in your project.
How do we track that?
We track that on the, I can speak to that. This is your annual assessment and your exit assessment. So stayer would be if they've been there for a year, and the exit assessment would be if they've left at a year or after. So if you have someone in your project for over a year, that measure will be on the annual assessment. And then if they left prior to that time, it'll be on your exit assessment. And this is something our CoC is doing great, but they're not actually writing it down. So if you guys could just make sure you update those assessments when you exit someone, don't just go, hey, they went to subsidized housing, actually answer all the questions And when social security increases every year, make sure that you're logging that, because that's just free points for all of your people. Even if it's $1, it counts.
This is an easy one for us to keep going up.
Mhm.
It's all about
Yeah.
taking that extra moment when you're exiting someone from your project to say, hey, they actually have more income than they did when they started. It's really, we should be able to keep going on this one. And
Yeah.
We've got it for both stayers and leavers this year.
Yeah.
So we're seeing a good positive trend on both sides.
I think next year will already be a lot better, just even since this ran. That was on last year's data. So I think this year will be awesome.
And then another 2 points for increasing the percentage of persons who had an increase in non-employment income. Or that rate was 50% or higher. We actually did that for our stayers this year. We got 65%, which is huge.
Yeah,
Great.
that is, disability income and social security disability.
Food stamps, anything like that.
That's the end of the system performance measures. And this is the last one that I have to talk about. And it's new applicant agreements. We scored 0 out of 14 points here. This is a all or nothing standard and it's worth up to 14 points. We get 7 points if a new applicant has a formal written agreement to be able to use housing subsidies or subsidized housing units, which are not funded through the CoC or ESG in their program. This is new applicants only. A couple of our renewal applicants have this one or the next one. Unfortunately, we're not able to put that towards these points. And then another 7 points comes from if a new applicant has a formal written agreement with a healthcare provider, promising some form of services to the clients that enter their program.
Are we gonna have that with greater agreement of mental health or? Okay. Well,
Can I ask a question too? Is it just the applicant or do they have to apply and also receive the grant to fulfill this, to check this box?
I see.
Like if they didn't give us bonus funds, if they didn't get it, would it still count even if they applied?
Well, if they didn't give us bonus funds, we've already got our score.
Like they're funded.
They're not gonna retroactively change our score.
So it just.
It doesn't matter if that applicant is funded or not. It's just at the time that we're creating our application, does the organization that's putting in an application as a first-time applicant to create a new project, are they able to say, hey, I've got this agreement with Greater Greenville Mental Health where they're gonna provide some services to the people in my program?
Nice.
That's the hard part, is that it's a new applicant.
Right.
It's not like a new program it would.
Right.
Existing
Right.
applicants.
So we could.
Yeah.
We didn't have
Yeah.
any new applicants that year,
Yeah.
Yeah.
you know?
And also visit if you don't have any new applicant.
Expansion for new.
Yes.
But it could be,
Oh.
yeah, it could be expansion grants.
Yeah.
Expansion grants count as new applicants, so.
Oh, really?
Yeah, so if we have,
First time.
then
Then they're back.
submit for an expansion grant, which I really hope we'll have this year, and they have one of these, that would work.
Mhm. Brooks, oh, we'll talk about it in a little bit, yeah.
Right,
Well,
so for
well-
new any new applicant, whether it's an expansion or not, I would think that the continuum would prioritize those when we're ranking, right? Not ranking, but yeah, eventually ranking. If it's a new project, or like if you had several new projects and you had to have a selection, which I've seen before, a selection process, then of course, if they were if they will allow the continuum to get these new points, and they would be prioritized, right? I assume.
Well, they haven't been before because usually what happens is the new ones, because we don't have any data on them yet, they're put in tier 2. Now, they have been in tier 1 before, but I mean, maybe that's something that we can look at is, in the
Yeah.
future.
There's a lot of discussion in the grants committee about that practice of putting new projects immediately in tier 2. Remember the calculation that I shared, that 40% of whether or not we get like the tier 2 funding is where they fall.
Right, well, I would think that the points would be assessed, though, if there is a new applicant in your application, right? Like when you apply and they see the new applicant, if you have a new applicant in there, wherever it is, tier 1, tier 2, it's part of your application, isn't that where you
Right.
could potentially get the 7
Yeah.
points?
It doesn't matter whether we put that new applicant in tier 1 or tier 2, just as long as they're part of our collaborative application.
Right.
We would pick up these 7 points.
Right, so.
But they would have to have the agreement with the healthcare provider.
Yeah, it's that written formal agreement again, that's difficult.
Right.
Produce.
Right.
And the commitment, really, to be honest.
Mm-hmm.
You know, we have our threshold requirements, which is a listing of things that the agency must meet before they're able to apply for CoC funding. And we have authority to change our local threshold requirements. I wouldn't suggest doing this now, because this is difficult for any agency to ascertain. But sometime in the future, you know, when we feel like we have a really good handle on funding competition and bringing new people in and expansion grants every year, I think it'd be worth adding that to the threshold requirements, where we say, you gotta show us one of these to be a new applicant. or
Yeah.
continue.
Yeah, that's exactly right, Natalie. That's what I was thinking along those lines.
Like, that would be real good.
So just a final summary, a couple things that we've done to improve over the past year, in a specific response to our 2023 score. We conducted a training on equal access and preventing family separation. We've, increased our connection with providers and street outreach. The grants committee is working on developing a racial equity standard on our rating tool. And we've made lots of improvements in our assisted performance measurement reports. That's a big deal. It's really good. Then a couple areas that are still needing improvement is our relationships with public housing authorities and public health agencies. Getting some greater involvement from specific organizations, including organizations for people that are a part of the LGBTQ+ population, tribal organizations, local jails, and early childhood development. Continuing the conversation about what we can do to improve our HMIS utilization rates and reducing our average length of time homeless. And then I've got that note, just keep in mind that these are based off of the standards in the 2023 NOFO. Standards do shift throughout the years, and it's not uncommon for new ones to be introduced. So I can't 100% assure that we're gonna achieve all of these points in 2024. This is just what we know based on what we've experienced so far.
Excellent.
Mhm.
Job.
It's very impressive.
Mhm. Yeah, that's why you scored a 10 out of 10 in terms of the CoC and